I'm Lisa Steele and I'm a naturopathic physician. My role at Optimal Health Group is as clinical director. So a naturopathic physician sees the world through medicine, but it's a different branch of medicine. So our training gives us all the baseline of medicine. We look at anatomy and physiology, biochemistry, pathology, but we also progress into botany and other aspects of nature. When we look at patients, we are looking at them through a medical eye. But where we divert from mainstream medics is that we do not employ allopathic methods of treatment. We do not employ pharmacology and we do not employ surgery. I got into this field primarily because my dad was diagnosed with multiple myeloma when I was 17. I spent my A-level year in hospital with him, trying to work out what was going on, why he was dying. He was 57, he was an athlete, and to all intent and purpose, he was well. The conundrum that presented with no response, no opportunity to heal, was enough to fire my belly. And so that's why I ultimately went in to try to find a way to understand why he had died. And that's one of the reasons why I looked outside the box and looked at other methods to find out how I could have helped him should it have been a possibility at the time. I love my job. My job is not a job. Everything I do is to serve others. And I believe that I have the capacity to support people well. There is nothing about my job that I don't enjoy, and there is nothing that I would do other than what I am doing. I have a very strong vision and I have a very strong belief in the power of self-healing. And this enables me to achieve a sense of well-being and a sense of reward for the time I invest in this. My vision is that people will fundamentally be educated sufficiently to be able to make their own decisions about how they manage their health. Medical autonomy is incredibly important. The reason why we struggle is that people have no knowledge and they have nowhere to find that knowledge. So it is a profoundly important thing that people are educated and supported to have the confidence to practice self-care. And in order for that to happen, there needs to be teachers out there that are able to communicate successfully to them and meet them at the level that they need to be met. And the art of what we do is actually finding that level appropriately to support that patient to the nth degree in order to act as a catalyst for themselves to find their own healing. The most rewarding part of my job, well, it's not a job, is two levels really. It could simply be a connection with that patient. Literally the opportunity to look across a table, to look into the eyes of that patient and to understand their pain and to be able to offer a hand. But at the macro level, it's about seeing people take control of their lives and transform from disease to supreme wellness. And they've done it themselves. And all I've been, or we have been, is catalysts in that process. That is the most rewarding thing. My day-to-day to look after me is take my dogs for a walk every single day, say my gratitude to the universe, to practice my breath work faithfully, to trust that everything is as it is, and trust that everything that we do and we're designed to do is for the right outcome, and to make sure that everything I take into my body is as good as it possibly can be. Yeah, we have lots of people who find it very hard to put their toe into the water and experience it. And I would say to them that everything we do is based on science, and the advancement of technology to support that process is phenomenal. It makes an enormous difference to be able to assess somebody in a very quick period of time and to be able to really see what will help them to improve their health. And so again, in meeting people where they are, the key thing is to go to the root, to find out why they feel skeptical, what their experience is to date of this branch of medicine. Once I can see why the skepticism is there, it makes it a lot easier to then understand what approach is necessary. And sometimes the approach is minimal. It's enough for them to literally take one step further forwards. But for many people, they can't imagine until they are in that room what's going to happen. And for most of the people who are brave enough to step over the threshold, once they see that it is based on medical information, it is based on science, and it's not open-toe sandals, they generally are able to experience an expression of their need. That can go a short way, or it can go a very, very long way. Part of my role as clinical director is to ensure that all the team are consistently trained in our technology and in our thinking. So every week we have regular clinic meet that enable all of the team to participate with regular lectures and regular discussions about certain case studies that may help them to advance their skill set. We work very closely together, we work across multiple patients, and the benefit of the whole is greater than the individual parts. So at Optimal Health, we have a broad range of specialist skills. The team all work together and train together. But what we try to do is to identify the right person for the right patient. Sometimes we need several people to support one patient because the needs are appropriate. But everybody is selected individually to try to be as close to the right therapist as is possible.